Good evening. My name is Dr. Matiko Giabe, the Acting County Director, Medical Services from the Department of Health. We are here to give an official statement and position of the Department of Health in as far as the events that happened at Nduru Level 4 Hospital are concerned, which occurred on the 12th of April 2023. On the day the events occurred, we had a medical team of which members are here and I wish to introduce them. Mr. Jared Maina, who is the Acting County Ambulatory Services, Theatres and Critical Care Director. Pamela Nyaema, who is a Senior Anesthetist, but in this capacity as a Deputy County Clinical Officer. Wycliffe, who is a biomedical engineer based at Nduru Level 4 Hospital. And Peter, who is the driver who took us to that hospital. So on the day of the events, we had left our headquarters in Kisii Town, heading to Nduru Level 4 Hospital to do two main things. One, there was a water pump that had broken down that necessitated a repair, but before that, we were to test it using the generator that is in the hospital, but they had challenges with the fuel, which we had to get from town. Two, we were to pick an anesthetic machine, which is a normal government procedure, under borrowing from one facility to another facility that didn't have that machine. So the relevant documents and authorization from the chief officer in the department had been done, and communication passed to the issuing facility at Nduru Level 4 Hospital. At about 1 p.m. we left heading to Nduru Hospital, and we were received well. The situation was calm until a point where we had completed filling the necessary documents and the machine issued from the relevant officer who had been left in the hospital. After a short while, when the machine was being loaded into the vehicle, a gentleman appeared from nowhere and appeared to be taking a video clip, and we asked him gently what he was doing, and he said that he was taking the video clip to record the work that was being done. So we requested him politely that we were not comfortable with that event, and he retreated. While retreating, he was seen waving towards the gate where a crowd of youths charged towards us, shouting that they wanted to kill the thieves who had come to pick the machine. Remember that communication had been done and authorization had been received from the chief officer, who was aware of all this. The SMOH, who is the head of the institution at Nduru Level 4 Hospital, was equally informed. So when they charged towards us, they started beating some of our members, one of whom is actually not here because he got injured and had a mental breakdown from that attack, and is not here with us, unfortunately. He is the receiving SMOH at Keumbu Hospital. When the crowd charged towards us, they started beating some of our members, some of whom you can see here sustained injuries. We have the driver here, who is still undergoing treatment, and our medical engineer from Nduru Level 4 Hospital, who is also undergoing treatment. The unfortunate occurrence has left the medical fraternity in that facility quite traumatized, and some of them have expressed interest to move from that facility. Much as we've been trying at the department level to ensure that they continue working, the events that occurred are still a trauma to them. We are trying at the department to ensure that they go back to work, and the current circumstances have been difficult to convince them. Our colleague who is not here actually suffered severe post-traumatic disorder and a panic attack to the extent that he had actually bid bye to his family when they intended to burn the room in which we were. Luckily, the security agencies got there early enough and we were rescued and secured. I wish to state that all procedures to transfer this equipment were followed, and the relevant authorities, both in the issuing hospital and receiving hospital, were informed. And the events that occurred to us, especially labeling healthcare workers as thieves, and yet this information had been passed to whoever was concerned, is quite unfortunate, and we condemn it as a department. To that extent, I wish to request the people of Nduru sub-county or South Mugirango sub-county to know that as a department, we are still working towards ensuring that healthcare workers and a safe environment go back and continue offering services there. While this is going on, we request them to remain calm and stop issuing threats to those healthcare workers who are still on the ground. Otherwise, we request the relevant security agencies to continue doing the investigations and furnish us with information that will be helpful to guide us in terms of advising the healthcare workers to continue their services there. Thank you.